Specific language disorders. What is specific language disorders? Specific language disorders, SLD, refer to a group of conditions that affect an individual's ability to understand, produce, or use language effectively. What is the cause? These disorders are not caused by cognitive impairments, hearing loss, or neurological damage, but rather by difficulties in language processing and development. SLD can significantly impact a person's ability to communicate, learn, and engage socially, particularly in academic settings. Some of the most common specific language disorders: 1. Aphasia. 2. Mutism, selective mutism. 3. DEVLOPMENTAL language disorder, DLD. Language disorders. Aphasia, a neurological disorder affecting language comprehension and expression, often due to brain injury or stroke. It can impact speaking, understanding, reading, and writing. Mutism, selective mutism, a condition where individuals, often children, consistently fail to speak in specific social settings despite being able to speak in others, e.g., at home but not at school. It is frequently linked to anxiety disorders. Developmental language disorder, DLD, a condition in which children struggle to acquire language skills despite normal intelligence and no clear sensory or neurological deficits. It affects vocabulary, sentence formation, and overall communication. Identifying students with SLD. 1. Classroom observations and behavioral indicators. Teachers play a crucial role in the early detection of language disorders by observing students' communication patterns. 2. Standardized assessments and screening tools. Once signs of SLD are noticed, formal assessments should be used to confirm and analyze language difficulties. 3. Collaboration with parents and specialists. Communication with parents and caregivers is essential in understanding the child's language development outside of school. 1. Classroom observations and behavioral indicators. Difficulty following verbal instructions. Limited vocabulary compared to peers. Struggles with forming coherent sentences, often omitting keywords or mixing up sentence structure. Frequent grammatical errors. Difficulty expressing thoughts clearly, leading to frustration. Challenges with reading and writing. Avoidance of speaking in class. Difficulty engaging in conversations. 2. Standardized assessments and screening tools. Clinical Evaluation of Language Fundamentals, CELF, evaluates receptive and expressive language skills. Peabody Picture Vocabulary Test, PPVT, assesses vocabulary comprehension. Test of Language Development, TOLD, measures spoken and written language abilities. Teacher and parent questionnaires help assess the impact of language difficulties in different environments. 3. Collaboration with parents and specialists. Teachers should discuss observed difficulties and gather insights about language use at home. Work with SLTs and special educators to create individualized support plans. Encourage families to reinforce communication skills in daily activities. Supporting students. 1. Classroom strategies for teachers. 2. Assistive technology and adaptive resources. 3. Individualized education plans, IEPs, and accommodations. 4. Encouraging social and emotional growth. 1. Classroom strategies for teachers. Simplify instructions, use short, clear, and direct language. Break instructions into small steps and reinforce them visually. Use multisensory learning, incorporate visuals, gestures, and hands-on activities to support understanding. Encourage alternative communication, allow students to respond using writing, drawing, or assistive technology if verbal expression is difficult. Scaffold learning, provide structured templates, word banks, and sentence starters to guide students in forming responses. Allow extra processing time, give students additional time to formulate answers and complete tasks. Implement peer support, pair students with patient, supportive classmates for cooperative learning activities. 2. Assistive technology and adaptive resources. Speech-to-text software helps students with difficulties in written expression, e.g., Google Voice typing. Text-to-speech programs supports reading comprehension, e.g., Natural Reader, Read and Write. Picture-based communication apps, beneficial for students with selective mutism or expressive language difficulties, e.g., PECS, Proloquo2Go. Interactive storytelling apps, engages students in language practice through digital storytelling, e.g., Book Creator. 3. Individualized education plans, IEP, specific learning goals tailored to the student's needs. Adaptations in assessments, allowing oral instead of written responses if needed. Regular progress tracking to adjust strategies as required. Collaboration between teachers, therapists, and parents to maintain consistent support. 4. Encouraging social and emotional growth. Create a safe and supportive classroom environment where mistakes are accepted and students are not pressured to speak. Reinforce strengths by focusing on what the student does well. Encourage small group participation before speaking in larger groups to build confidence. Teach self-advocacy skills, helping students express their needs effectively. Strategies for creating inclusive learning environments. Classroom strategies. Use clear instructions and visual support. Encourage gestures, visuals, and assistive technology. Provide predictable schedules to reduce anxiety and confusion. Individualized support plans. Modify assignments and assessments to match the student's communication level. Provide additional support through special education teachers or speech therapists. Assign peer buddies to facilitate communication and inclusion. Encouraging a positive and inclusive environment. Promote patience and understanding among classmates. Celebrate small achievements to build confidence. Foster a supportive space where students feel comfortable expressing themselves. Tips and recommendations for teachers. Build awareness and knowledge. Adapt teaching methods. Foster an inclusive classroom. Adapt assessments and assignments.